this is Gilly Carter, and this is my assessment video for the heart, the neck vessels, and the peripheral vascular system. Again, my patient today is going to be my dad. He's in the recliner. We're going to act like this is a bed, so I can raise the head of the bed. Of course, I would have already done my subjective data, asked him to change into his gown, answer any questions, and then begin the physical assessment portion. So first I'm going to assess the neck vessels. I would stand to the right of the bed or my patient, and I'm going to have him supine, which is on his back. I would have the head of the bed raised about 30 to 45 degrees, and I'm going to observe the jugular venous pulse. So I'm just looking. Can you slightly turn your head to the left? Slightly. Okay. Very good. Do the other side. Okay. Good. Okay. So now I would be inspecting the, hope I'm saying this right, the suprasternal notch area, which is right here. So I'm just looking, I'm just assessing the, kind of this little notch right there. I don't know if y'all can see that on the video. All right. So now I'm going to be evaluating the jugular venous pressure. So at this point I would raise the head of the bed 30, 45, 60, and 90 degrees and assess for distension. Let's see, can this go all the way? Is this all the way back? There you go. So this is about 30. Okay. 45. 60, 90. Okay. From what I can tell, there was no distension, no bulging, no protrusions. So now I am going to auscultate the carotids. We're going to auscultate before we palpate on the carotid side. So what I'm going to do, if I had an alcohol pad, I would clean my stethoscope, make sure it's nice and warm. Let's see. What I'm going to have you do is you're going to turn your head to the side, taking a deep breath, hold it, and let go when I tell you to, okay? All right, turn your head this way. Deep breath in. Hold it. Let go. Good. Try this one. Deep breath in and hold. Good. Let it out. All right. What I heard, there was no evidence of any bruit. So now I would palpate the carotids. I'm going to do one at a time. You never want to do two at the same time. So I'm just feeling. Perfect. Good. Keep him out of the way. Good. Okay. They're both bilaterally strong and equal. So then I would inspect the interior portion of the chest. I'm going to have you push your hand just a little bit. Okay. So I'm inspecting that portion. I'm looking for any pulsations. I'm looking at the apical impulse area. Any unusual, abnormal vibrations. Okay. Now I'm going to palpate the apical impulse. So what I can do is still stay on his right side, or this is an actual table. I could have the patient lie on their left side, left lateral, and I can easily feel for it that way. So I'm going to use my fingertips, and I'm just going to feel, and it's going to be the mid-clavicular, 4th to 5th intercostal space. So mid-clavicular. So I palpated for that. Now I'm going to palpate for any abnormal palpations or vibrations. I'm going to use the palm of my hand now. There is no abnormal pulsations, vibrations. So now I would move on to auscultating the heart rate and the rhythm. For the video purposes, I'm going to cut down the minute time on listening to this to about 30 seconds. I'm going to times that by 2. I'm listening for the rhythm. Is it irregular? Is it slow, fast? And I'm going to time it for how many beats per minute it is. So, again, I'm going to do 30 seconds and times it by 2. Go. So what I'm hearing, it's a regular heartbeat, and it is 82 beats per minute. So let me end this right here. All right. So now, let's see, I'm going to auscultate for the S1 and the S2, which is the lub-dub that you're hearing. So S1, I'm going to go above, up over here. And what helps me is that I'm going to listen to his carotid. I'm going to palpate for the carotid too. There you go, thanks. Okay. And then I'm going to listen to the S2. Actually, cut that. S1 is down here. Okay. S2 is up here. All right, S1 and S2 are noted. So now I'm going to move on to inspecting his arms. Dad, if you want to put on your shirt, that's fine. So I'm going to be inspecting his arms for symmetry, for size. I'm looking at the color, looking if I notice any edema or anything like that. So, can you flip them over for me? Okay. Good. So what I'm noticing, the size is symmetrical, color is even distribution throughout. I didn't see any edema. So now I'm going to palpate the arms, the hands, the fingertips. I'm going to check for cap refill. I'm going to check for temperature with the back of my hands. So let's see. Check for any moisture. Pain, tenderness. Cut yourself in the garden.
Your dog.
No pain, no tenderness on this side. Okay.
Tip bite.
I'm checking his cap refill. Okay, good. Temperature is within normal limits. His skin was warm and cap refill was less than 3 seconds. so now I'm going to palpate his radial pulses. So, this over here. Okay. Both equal bilaterally and they're strong. I would give it amplitude 2+, which is normal, within normal limits. I would then check the ulnar pulses. So I would use three fingertips now. Go on the opposite side. Okay, I'm not gonna lie, I have to push it down a little bit harder to feel, but they are still pretty strong bilaterally and they do feel equal. So now I am going to palpate the brachial arteries on both sides. Good. Okay. So now I am going to check the nodes. I'm gonna butcher how to say this. Epitrochlear nodes, lymph nodes. I hope I said that right. So what I'm gonna do is act like I'm shaking his hand, and I'm gonna feel in the upper arm area between the bicep and the tricep. I'm gonna feel those lymph nodes there. So I act like they're shaking my hand down. Kind of bend it a little bit. Okay. On the inside part of his hand. His arm, I'm sorry. No pain, no tenderness there? Okay, good. No pain, no tenderness? Okay. Honestly, I'm not really feeling much of anything. Nothing seems to be movable. And he said that there was no pain, no tenderness there. I didn't feel any enlargement or anything. So now we are going to move on to performing the Allen test. And what we're going to do is I'm going to have a TV tray and I'm going to act like that's my table. So let's see. We're going to put this flat now, if we can. So what I want you to do, Dad, is you are going to put your arm like this, palm up. You're going to make a fist. And what I'm going to do is I'm going to occlude both your radial and your, you don't have to do both of them at the same time, arteries at the same time. And then when I tell you to let go with your fist, I'm watching to see when the coloration comes back in the palm of your hand. Feel? Okay? All right, good. Now let's do the other side. Like that fist. I'm feeling the radial, the ulnar, including those. Let go. Good. So the return of color was less than 5 seconds, so that's really good. It turned a nice, good pink color. It seems that the radial and the ulnar pulses are patent. And now I'm going to move on to the legs. I'm going to inspect the legs for the color, any lesions, distribution of hair, and symmetry, any edema. So I'm just inspecting that, just looking. Can I take off your socks?
Sure.
Okay. Just looking. Okay. Color seems to be even throughout. The size is symmetrical. Excuse me. Hair distribution seems even on top and on bottom. Let's see. No presence of edema from what I can see. So now I'm going to palpate for edema. I'm just going to press in a little bit to see if there's any fluid retention. Let's see. No presence of edema noted. So now I am going to palpate the temperature of the legs and the feet with the back of my hands. So just checking for circulation. Alright. Temperature seems to be within normal limits. Skin is warm. No moisture, anything like that. So now I'm going to move on to palpating the inguinal lymph nodes, and then I would auscultate and palpate for the femoral pulses. So I'm not going to do this on video to my dad. I don't want to expose this area and post it on YouTube. So I'm going to show you the instructors where I would normally do it on a person, on a patient. So what I would do to feel for those lymph nodes, I'm going to go towards the medial thigh area right there, and I would palpate for tenderness, any movable masses or anything. So again, medial thigh area, and I would even go up to right here. I don't know if y'all can see that. There's kind of a glare. Then I would palpate for the the femoral arteries. So I'd palpate, make sure they're even bilaterally and strong, check the amplitude. And I would also auscultate with the bell of my stethoscope, and I would listen to both sides. So that's what I would do on a normal patient. Again, I'm not going to do that and post it on YouTube for the world to see. So I apologize for that. But now I'm going to move back onto my patient, and we are going to finish up with the popliteal pulses, which are on the backs of the knees. So let's put this back again. I'm going to raise it up just a little bit. So again, they're on the backs of the knees, which are always a little bit different for me to feel. Okay, there we are. All right, good. So now I would move on to the distal tibial area, which is on the ankle. Let's see, I don't know if we can see that on the video. Let's see, hope we can see it. So I'm going to go on the inside, if you can see there. All right, on both sides. Good, okay. Both very strong, even bilaterally. So now I'm going to check the dorsal pedis, which is on top of the feet. Awesome. Okay, good. All right, so even bilaterally strong, I would say amplitude of 2+ again. So I'm going to check the cap refill on the toes. All right, cap refill is less than 3 seconds, so that's normal. I would then check for for varicose veins and any thrombophlebitis. So what I would have my patient do, is there any way you can stand up, Dad?
Yeah.
And I'm just going to inspect the veins, see if there's anything that is bulging, if there's any redness. Okay. Everything looks good. The veins seem to be flat. There's no bulging of any kind. There's no redness. I didn't feel any warmth. So then I would go to the position change test. So I would start with my patient supine. So let's go back. I'm sorry, Dad. And again, for the purposes of the video, to make this shorter, I would go behind him, and I would raise his legs up, have my hands underneath his ankles, and I would have his feet go up and down for 1 minute. But again, for viewing purposes, I'm gonna slow this down, or speed this up actually. Then, if this was an actual bed, I would have him sit on the edge of it and dangle his feet. So, again, dangling the feet. And I'm just checking to see when the color comes back. I'm going to check the soles of his feet, make sure they're nice and pink. And, okay. From what I'm seeing, color is good. A nice, good pink color came back within about 5 seconds. So, everything looks to be good. So this concludes my video, and let me know what I need to work on. Thank you.